This is Ashley Klein-Jimenez from Prevent Connect and Cal CASA. You are joining us from Foundations to Conversations and Innovations, applying a public health approach to prevention of sexual and domestic violence. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or Cal CASA. So that's enough for me. I want to introduce you to our Prevention Institute team, Alicia and Abina. Alicia, Abina, thank you so much for being here to facilitate this conversation. I'm going to pass it over to you.
Thank you, Ashley.
Yeah, thanks, Ashley, for having us. And I'm glad that you showed the slide that featured the names of all of our web conferences from 2018, because I really want to take a moment right now to celebrate the success we had in 2018. During the year, through our series, approximately half of the sessions featured a guest who identifies with masculine pronouns. We also had several sessions that feature local and state-level partners from the same state, so they were really able to showcase how they're working together, which I really enjoyed seeing, specific localities and their state-level partners. We also had representation from urban, suburban, and rural communities, as well as age diversity. One of our web conferences even featured a high school student, which was really fun to have those, type of voices with us as we talk about prevention and prevention across the life course. We also had guests from outside of the sexual and domestic violence prevention field. We had someone who works in alcohol justice, a teacher, folks working in economic empowerment and policy organizations, and more. So with all of that, we're just, looking forward to today getting back to the foundations of what a public health approach to violence looks like. And with that, Abina, can you share what our objectives are today?
Yeah, thanks, Alicia. So our objectives for today's session are to identify fundamental elements of a public health approach to preventing sexual and domestic violence, to discuss emerging themes and innovations in the field, to review determinants of sexual and domestic violence using THRIVE, a framework and tool to address the social determinants of health at the community level, and to provide examples of effective primary prevention strategies and training tools. Since one of our main objectives today is around understanding a public health approach to preventing sexual and domestic violence, I'd like to pose a question to our audience to respond to in the text chat. The text chat question is, what does a public health approach to preventing violence mean to you? Does this terminology resonate? We know that sexual and domestic violence prevention field is a multidisciplinary and draws from feminist theory, public health, and more. So we're curious on your thoughts to this question. Alicia, while participants are sharing their thoughts in the text chat, can you share how we define a public health approach at Prevention Institute?
Yeah, sure. Please, everyone who's participating today and on our web conferencing platform, please share in the text chat. We'd love to hear from you, what does a public health approach mean to you? And, I know that the field also draws from other disciplines. Many people in the field aren't working in this, don't have, education in this field necessarily, maybe coming from other disciplines, and public health really draws on lots of different areas, so love to hear what you have to say here. The way that Prevention Institute talks about prevention and a public health approach is they really see it as rooted in science and focusing on the maximum benefit for the largest number of people. So I already saw someone writing about how it's population-based, and you can see that written on the slide here. It also seeks to improve health and safety of all individuals by addressing underlying factors that increase the likelihood of violence, and also strengthening factors that build resilience. So today we're hoping that we can examine themes in the field, and through that we'll be able to unpack more what a public health approach really means. As I think Ashley mentioned earlier, we really focus on prevention through Prevent Connect and at Prevention Institute. And by prevention, there's a whole continuum of what that could mean. And here we really focus on the upfront, or that's often called primary prevention, which is about approaches that take place before violence has occurred. And of course, we acknowledge the importance of, the in the thick or secondary prevention, which is more intervention-based, and the need to address the aftermath or dealing with things like trauma after violence has occurred. But the purpose of this platform is really to focus on primary prevention, which can really have a population-level impact. So we're hoping to explore that further with you today. So I'd love to hear from Tori and Ashley. What's been coming up in the text chat? What have people been saying? Does the public health approach seem to, that type of language resonate, or are people using other language?
Thank you, Alicia. And yeah, that language is really resonating. This has been a very active text chat so far, so I'm really excited to see how active the text chat is for the rest of the session. So I really love what Rhonda Jackson just posted in the text chat, talking about recognizing the impact of social determinants of health and health equity. And I think we're going to talk a little bit more about this health equity lens later in the web conference. So thank you, Rhonda, for bringing in that perspective. And also people calling into the intersections with other fields and systems and cross-sector collaboration. We can't deny the intersection between racism and violence. Like Rhonda said, people are also talking about moving beyond the individual level and into the population and social level. And that's really how people see this comprehensive approach. And of course, I do see that someone brought up the social ecological model. Thank you for people who have been posting that. And yeah, I'm going to agree with the last couple comments on here. Rhonda rocks. Ashley, did you catch anything else in the text chat?
Yeah, I was looking at the ways that it was resonating for folks, and I really liked what Megan had to say, that the public health approach opens the field and the work and the solutions up to everyone, not just people who are maybe working specifically to prevent sexual or domestic violence. We know that we really need approaches across sectors, and so the public health approach really allows us to operationalize that.
Awesome. Yeah, and I also saw a comment about thinking about the cultural, societal, and interpersonal factors and how a public health approach gets us to thinking beyond just thinking of the issue as interpersonal, but thinking about the elements around it, which relates back to the socio-ecological model. And those of you who aren't familiar with that model, we will be sharing more about that, but it's basically looking at the individual, relationship, community, and societal levels to see how they're all interacting. And so even if violence, does happen at an interpersonal level, thinking about how the broader community can shape that. So we'll be definitely talking about that more today. But before we go any deeper in our conversation, I'd like to introduce our guest for today. So we have Jennifer Grove, who is the Prevention Director at NSVRC. Hi, Jen.
Hi.
Thanks for coming and joining us. What are you thinking about what we've been hearing in the text chat? Does a public health approach terminology seem to resonate with the work you're doing?
Oh my gosh, absolutely. I'm reading the text chat and I'm thinking, well, we can all go home now because it feels like you all know what we're going to talk about today. And you already know all of the things. But absolutely, I love this connection around the risk and protective factors and how they're common across multiple forms of violence. Absolutely that connection between racism and violence and health inequity. I'm loving all of this, and I was kind of deep into the text chat when you said my name, and I was like, oh, I gotta pay attention here. So
that's funny. Well, we're honored to have you today. Jen has worked in the sexual violence prevention movement for over 20 years. She spent the first 7 of those years working in community-based domestic violence and sexual assault programs, and in her current role, Jen coordinates the national prevention work of the NSVRC, which stands for the National Sexual Violence Resource Center, providing training and resources to sexual assault coalitions, state departments of health, community programs, and other organizations that are working to develop, implement, and evaluate sexual violence prevention strategies. So based on who we have in the audience today, I'm assuming many folks have probably met you or know of you already.
Yes, I recognize those names.
Oh, good. Can you share for those who may be less familiar with the NSVRC and your work, can you tell us more about what you do?
Sure, yeah. So the NSVRC, we are located in Harrisburg, Pennsylvania, and we are pretty much, as our name entails, we are the place to go nationally for information and resources on the topic of sexual violence. We maintain a library that's actually the largest library of its kind in the world, focused on sexual violence resources. We receive our core funding from the Centers for Disease Control and Prevention, and so we have a really large focus, obviously, on prevention and creating resources, providing training, and providing customized what we call technical assistance, which is really information and resource sharing on the issue and on prevention. And so we also coordinate the National Sexual Assault Awareness Month campaign, which the 2019 theme is around consent. It's called I Ask. That's the name of our campaign this year. That's another big thing that we do. And then in this training piece, you know, we average about 15 in-person trainings a year with local and state rape prevention education grantees, and we have I think through that we really have a finger on the pulse of what those state grantees and their state and local partners need. And so that's just a little snapshot of what we do at the of some of the things we do at the National Sexual Violence Resource Center.
Awesome. Yeah, and I'm hoping that you can draw on those different experiences to share with all of us today over this web conference.
Absolutely.
So what we're going to be doing today is going through some emerging themes, and it seems like many of you have already mentioned some of these themes through the text chat, so hoping that you can continue using the text chat to share how your work may fit these themes or help illustrate them, and we can even draw from the text chat to share out with everyone today. So we're going to go through them one by one, but I'm just going to list them out first. So one is how many practitioners in the field are really operationalizing a health equity approach. Oh, looks like my slide isn't quite working, but basically the emerging themes are around health equity. The second one is on how a lot of communities are focused on improving both community environments and norms, and this really goes back to the point about, you know, thinking about violence not just as an interpersonal issue, but thinking about the community and societal factors as well. Multiple forms of violence, I know, was already mentioned, and so we're seeing more and more communities work across forms of violence. And then the last theme is on how we're seeing many practitioners in the field align with other social justice movements and sectors. So I know that people have already been talking about the need for multidisciplinary action and working with other fields. So sounds like you're already thinking about this. Our first theme has to do with health equity. And so at Prevention Institute, you know, we like to start off by first sharing a definition of health equity and then really highlighting what it means using our 2 steps to prevention. So what is health equity? It means that everyone has a fair and just opportunity to be as healthy as possible. And so when we're thinking about prevention of sexual and domestic violence, it means that everyone has a fair and just opportunity to like sexual and relational health. And for the purposes of measurement, health equity means reducing and ultimately eliminating disparities in health and its determinants that adversely affect excluded or marginalized groups. And so as I mentioned, we like to use something called 2 steps to prevention, which we use for a range of health outcomes at Prevention Institute to understand the relationship between the health outcome, exposures and behaviors, and the environment that shapes them. And this really helps identify opportunities for preventing the issue before it happens. So first, we look at sexual and domestic violence and the inequities in rates of sexual and domestic violence. So based on research that we've looked at, we know that women, especially those facing poverty and women of color, as well as young people, transgender people, bisexual, gay, lesbian people, have higher rates of sexual and domestic violence. But we also know that research tends to ignore the sexual and domestic violence that men may have faced, and there isn't as much research on that. And so as we take our first step, we start to look at exposures and behaviors that may be associated with these forms of violence. And so some things may be a history of multi-generational violence or isolation, lack of emotional regulation, and often people might stop at this level, just thinking about the exposures and behaviors and trying to address those for prevention. But a public health approach really gets us to also think about our environments and how the environment or the social determinants of health shape these exposures and behaviors. And so we split up the environment into both structural drivers and community determinants. And this is kind of where the health equity piece of it fits in. So the WHO has identified structural drivers to mean the inequitable distribution of power, money, opportunity, and resources, and really sees this as a determinant of inequity in health and safety outcomes. And so this really has to do with power and how people with less power tend to suffer worse health outcomes. And then we also can see how inside of this circle of structural drivers, we also see our community environments. And we know that these structural drivers, whether it's racism, sexism, ableism, etc., really do shape the circumstances in which people are born, in which they grow, live, work, age. And so the WHO has also identified community environments as a key contributor to inequity in these health outcomes. And so these play out at the community level and impact our community conditions. So a lot of communities that are taking more of a health equity approach are really calling out things like racism and sexism and thinking about how they can make changes in their community environments to push back against those structural drivers. So as we go through themes, I'm going to share some examples. I'm going to ask Jen to share some reflections as well. So the first example I wanted to share, which we've brought up before on Prevent Connect, is the work that's happening in East San Jose in California. So through its Accountable Communities for Health initiative, the community has prioritized violence prevention as its priority. And so it's working together across 3 zip codes and really focused on changing these community environments that have, contributed to these inequities in the community and to the violence that they're experiencing. And one thing that they've done in taking a health equity approach is ensure that residents are part of the dialogues, and when people that are part of the leadership team represent an organization, trying to encourage those organizations to select members that live in that community, in those 3 zip codes, to be on the leadership team. And they've also been doing many discussions with the leadership team, which includes people that are in, systems, government, along with community-based organizations, residents, and together they've been talking about the inequities that their community is facing as a way to move forward. Another effort that I wanted to mention that we featured on Prevent Connect a few months ago in our session that was all about culturally informed prevention, we had the Oregon Coalition, which shared their Prevention Through Liberation work. And so Prevention Through Liberation is about setting people and societies free through stopping sexual and domestic violence and promoting sexual and relational health. So this initiative recognizes that oppression is at the root of violence, and so when they talk about, root causes, they see the need to talk and these being very central for violence prevention. And so not only have they developed this whole framework, but they also are funding micro grants and also will be funding full grants for culturally specific sexual violence projects in Oregon focused on anti-violence. And Jen, I know that you've had some interaction with this work, and even just generally, how does this theme resonate for you and what's kind of coming up?
Yeah, we love that. We love this project through the Oregon Coalition. In fact, myself and Mo Lewis, our prevention specialists, are part of the advisory committee for that, and it's been such a pleasure to be invited into that group and looking more closely at, thinking about the link between various forms of oppression and sexual violence. We've been talking about that link for quite some time here at NSVRC, and in our trainings that we do whenever we're talking about root causes and risk and protective factors, these are things that always come up because oppression and sexual violence are intrinsically linked. They're, specifically, we look at racism and think about how that impacts our work in communities, and also access for those communities to the necessary resources. And so we had an amazing opportunity last August to work with Vanessa Timmons from the Oregon Coalition, and we were invited to come and co-present 4 regional trainings throughout the state of Nevada, which is in and of itself a very interesting and wonderful opportunity for us to do the same training and sort of saturate the different areas of the state with training on community level prevention, thinking about prevention, and also really thinking about it through this liberation model. And so, we here at NSVRC sort of brought in our primary prevention and public health approach to that training, and then Vanessa pulled in pieces around diversity and inclusion in our work. And then we had communities be working on doing SWOT analysis, a SWOT analysis of that, which is the strengths, weaknesses, opportunities, and threats of their prevention work through this inclusion lens. And it was just such a wonderful opportunity to think about how we even do our training. And we're talking about these things, but how are we incorporating into our community level work, like how are we getting people to really look at it and talk about it and think through what's missing, what would help them think through this liberation lens. And it was a really great opportunity to be able to do that.
We have a question coming up in the text chat about how you can measure impact of these community prevention efforts. And so we did do a web conference that was about evaluation of community-level prevention. And so maybe, Tori, if you can post the link. Oh, already got it in there. Tori's fast. So if those of you who are interested more in evaluating this type of work, I think that session's a great starting place. Measuring this type of work is difficult compared to measuring just a single program. Because it's more, overarching and across the community. But there is, more work that's been happening. And Ashley just also shared NSVRC's evaluation toolkit. Jen, anything else you want to say about this, question around measuring impact?
Not much more, except that I do think if you check out the evaluation toolkit, there is a segment in thinking about those outer levels strategies and how do we evaluate that, and also that webinar is a good link as well. But I know that we are doing some work right now with some groups around that topic, and I think we're going to have a little bit more sort of lessons learned from that. But we're doing a lot of work right now around activity-based assessment in doing this community level evaluation work. So I think there's some really interesting things that can be incorporated in communities. Participatory evaluation as well is really key when you're doing community level work. So I'm hoping we'll have a lot more information to share as people are using tools and learning from them and sharing that with us.
Great. We have another question about if links will be available after the web conference is over, and the answer is yes. We definitely want to make sure that these resources are easily accessible, because that's why people do all the work in creating the resources. We want to disseminate as much as possible. All right, so our next theme is on how communities are really focusing on improving community environments. And so, people have really been thinking about the sociocultural environment and things like norms and social networks, and how connected community members feel with each other. And there's also expanding efforts to improve the physical built environment, and also thinking about economic opportunities. And so we call this type of work that's focused on community environments community level change. And I think that this has been quite the buzz term. I know CDC has been talking a lot about community level change as well. And Jen, I know that your work has been also really been focused on this. And you've been talking a lot about the difference in terminology, how there's both terminology around community-based work and community-level work. And we know both are important, but they are different. So can you share more about that with us?
Yeah, it is the buzzword of the moment, community level, because for anyone getting rape prevention education funding starting in another week with the new funding cycle, that's a huge, that's a big push of the new rape prevention education funding. And we're trying to say, don't freak out. You're there. Some of you are already there, and some of you have been there. And it is a little shift, though. It is a bit of a shift. But usually once we talk about what community level means, people are able to see how some of the things they are already doing fit into the definition. So when we think of community level, and I like this slide because when we're thinking of community level change, we're thinking about things that regardless of whether someone participates in a prevention strategy or group or any efforts, they are going to be impacted by the community level change. So it impacts the entire community regardless. And so that's one way we describe it. And so we have these next couple of slides that we use in our trainings to talk a little bit more about specifically looking at what community level change looks like. And so we have these kind of words that we use when we're looking at change at the different levels. So typically we've been in these first two levels, individual and relationship, where we're looking at changing attitudes and beliefs and behaviors. We're looking at enhancing these relationship skills and boundaries and communication skills. At the community level, this is where these sort of code words come in: policy, procedures, climate, codes of conduct, bills of rights, the environment, programming that confronts their beliefs around gender stereotypes, victim-blaming attitudes. They're also learning in workshops. They're having workshops for parents. They're leading workshops to increase positive communication about sex and relationships. So at these levels, we're still talking about individual and relationship change. And when we look at community, another level that they could go into with this programming is taking it one step further, where the students in that social justice group work with the staff and faculty to pass a student bill of rights. Possibly there wasn't one there before, or they had one and it just wasn't really updated, or it wasn't meeting the needs of all of the students. And so that's an example of at the community level where they're doing something that's affecting everyone in the school, because everyone's going to benefit from the passing of that student bill of rights, whether they were involved in the prevention strategy or not. And then one step beyond that would be they're working with the state coalition to promote a bill requiring comprehensive sexual health education in the high schools. And so, but if we look at that community level, again, we're looking at how, what can we do, laws, policies, codes of conduct, culture change, whatever it might be, that's going to affect everyone in the community. And I did want to just give a shout out to a report, if you haven't read it. This is something that we have, we developed, 2017, I believe it was released, and it provides, this is our Innovations in Community Level Prevention report, and it provides information about some innovative programs that are doing work at the community level. And it specifically looks at community mobilization and public policy work within multicultural programs. There's a local sexual assault program that's featured. There's an initiative from a state Department of Health. There's K through 12 prevention education policy efforts at the state level led by a state coalition. So this is an example. This report provides some examples of what some of this work looks like on the ground in real life.
I've definitely read the report and found it very helpful. So thankful to NSDRC for putting that together. And thank you, Jen, for just helping illustrate what community level means to you and, work that, how it's attainable for communities.
Yes.
So we also want to hear from our audience today. What have you found helpful in explaining community level prevention in your community? We know some of you are already doing this work and you've had to talk to others in your organizations that may not be focused on prevention, and they may be like, well, what does this thing have to do with prevention? How are you making the case for community level prevention, internally in your organization or externally in your community? So please share in the text chat and we'll come back to see what you're all saying. So a quote that we like to use from the Institute of Medicine says, "It is unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change." And this relates to what someone else posted earlier in the text chat about, thinking about the societal, cultural, interpersonal nature. And it reminds us that we need to think beyond just the interpersonal level to think about why violence is happening or other health issues for that matter. So Prevention Institute has a community resilience framework called Thrive. Jen, can you put yourself on mute for a second? I'm getting some echo. Thank you. So our community resilience framework is called Thrive, and it's made up of 3 interrelated clusters that helps us think more about what we mean by the community environment. And it's split up into people, place, and opportunity. And it helps us understand how structural drivers are playing out at the community level and how communities can push back against these structural drivers. So Prevention Institute looked at the literature base and spoke with key informants to look at what factors at the community level are associated with domestic violence and what community level resilience factors are associated with safe relationships. So often in the field, we'll focus a lot on the people factors, and it makes sense due to the interpersonal nature of violence. People think a lot about the norms, and these may include norms that support healthy relationships or nonviolence, or norms that support engagement in family matters and make violence not just an issue that is private and not talked about. So I know we often talk about that, or we'll talk about community social networks and those types of things. But more and more we're seeing people also talk about place and how things like low alcohol outlet density, which means the number of alcohol establishments in a given area, and how when there's less of those it can help decrease multiple forms of violence. That's been something that's been increasingly talked about. Or media and marketing for healthy relationships. We know that ads that may hypersexualize women or alcohol ads can contribute to violence, and so how can we use that in the resilience standpoint of thinking more about healthy relationships. Housing is another piece, so we know that safe, stable, and affordable housing can help decrease domestic violence. And then in the equitable opportunity environment, the research shows that family and community economic security actually helps support prevention. And this is also true from the research we've seen on sexual violence, and has been a focus on one of our web conferences recently that was all about economic opportunity and people looking at things like the wage gap or wage equity for prevention. So I'm going to give a few examples. So the first example that I want to give, which connects to the sociocultural environment and changing gender norms, we had a guest from Promundo, which is an international organization, and one of their programs is called Program P, which focuses on engaging men in active fatherhood from prenatal and beyond. And this is based on a growing body of research that shows how men's involvement in caregiving can help prevent gender-based violence and violence against children. And it's been used in Brazil, Indonesia, Rwanda, so many different localities have put this into action. And the program really involves hands-on activities with fathers that challenge traditional gender norms, and it also involves a component working with healthcare providers. And to really get to more of a societal level impact and thinking more about policy, in Brazil, for example, an ongoing relationship with the Brazilian Ministry of Health has allowed partners that are involved in Program P to more effectively lobby for an extension of paternity leave. And so they've been able to build more political will for policy change. And the results from the study in Rwanda, that's the place where they did some deep evaluation work, they found that men were nearly half as likely to use violence against their partners after almost 2 years of participation in the program. And they also tended to spend more time doing household chores, which supports more egalitarian practices in the home. So we've shared some resources with that. Another one, we talked about the physical built environment and how communities are thinking more about decreasing alcohol outlet density. Alcohol Justice was on a web conference this year, and they're a member of the Los Angeles Drug and Alcohol Policy Alliance, which is currently organizing with the support of a council member to pass a city ordinance that would create alcohol-restricted use subdistricts. And so this is a planning tool that places a limit on the number of alcohol licenses that are granted in selected neighborhoods. So what this basically does is it gives the power to the residents to determine when a new alcohol establishment or someone's wanting to get a license, whether or not they can go about doing that. And Jen, I know that NSVRC has been thinking about alcohol outlet density, and in the innovations report, there was an example there with a really great graphic that I'm hoping you can help explain more about this connection between alcohol and prevention.
Yeah, this is work that's come out of New Mexico. CDC has highlighted a lot of this work, and there are a lot of states actually who are examining alcohol outlet density. So as you said, like looking at that connection between the number of alcohol serving establishments and the correlation to higher levels of crime in those areas. And obviously there is a correlation there, and it provides this really unique opportunity to work at various levels of the social ecology to address and prevent it. So with this illustration, I like how it's looking at these three levels, because there's a lot of work that, foundational work that's done where you're educating folks, on the city councils, and, you're looking to also look at, defining the role of government in preventing alcohol-related harm and all of these things. But you're ultimately looking at this. If you look over at the community level, you're ultimately looking at zoning ordinances and using zoning ordinances to prevent these establishments from operating or from being built in these locations or these environments or these neighborhoods, and in effect reducing alcohol use and decreasing incidents of violence such as sexual violence. So it's kind of that's where all those kind of arrows are pointing back and forth to, because it's the zoning ordinances that are creating these safer spaces, and in effect really looking at reducing violence in general in those areas, since there is that direct link.
Awesome. Yeah, I find that this graphic is really helpful to understand more of the theory of change, because it can sometimes seem a little abstract, or how does this all connect? So I really appreciate being able to see how zoning ordinances can contribute to reduced alcohol use, or at the relationship level, a lower incidence of sexual violence. So thank you for the graphic. So we've talked about an example in the sociocultural environment, or people. We've talked about an example in place, or the physical built environment. And so I also want to share one from the equitable opportunity environment, which has to do with economic security, both community and family economic security. So on our web conference that we did on getting started on working on economic opportunity, one of our guests was the Ohio Domestic Violence Network, and we had both someone from the Ohio Domestic Violence Network help plan with us with the Ohio Women's Public Policy Network, which is a partner that they're collaboratively working with to advance economic security in the state. And so these two networks and their partners are building an understanding of and advocating for wage equity and other worker supports. So they've formed and they now convene a work group that's focused on wage equity and other worker supports. And they've been able to really build a larger network of support and encourage cross-learning across the various organizations. So on the slide right now, you see some of the other partners that are involved in this, and they keep growing the tent to create, build that political will to advance policies and practices that relate to things that will really support workers. And what they found is, what they really believe is that integrating issues like violence and infant mortality, poverty, and other issues that are priorities in the state really works well, and it's better to take them on together rather than alone. And they found that to be really productive and efficient as a way to move policy forward. So rather than just talking about, for example, raising minimum wage to help with poverty, they're also talking about connections to some of these health and safety issues as well in their work. So that helps in building the case for these different policies. And so even though the network can't directly work on policy, by creating this work group, they're helping build a bigger tent for wage equity and other worker supports. So Ashley and Tori, we'd love to go back to the text chat. It seems like it's been moving. I haven't been able to keep up because I've been talking. So what's been coming up in the text chat?
Hey, Alicia. So there's been a lot of great resource sharing and conversation. I have to say, I don't know if I saw much around how folks are explaining community-level prevention. Tori, correct me if I'm wrong. Maybe you saw something that I missed.
No, Ashley, I was actually going to ask you to share a little bit more about the explanation that you gave.
Yeah, so I guess I'll say that I'm a little bit of a fangirl, and I think, Jen Grove, you might share this with me, for Dr. Linda Dahlberg at CDC. And so I think from being able to listen to Linda talk about community-level approaches, something that I've just kind of like watered down to help my brain be able to process what community-level prevention means and how I can explain that to people, and Jen, you said this, is that, when we're doing community-level prevention, individuals don't ever need to be part of that intervention. We're not even necessarily talking about the issue of sexual violence or interpersonal violence, but everyone is still being impacted, and we're still doing things to create environments that are protective against sexual and intimate partner violence. So that's kind of how I explain it to people, and I think examples are so important. And I'm trying to find it, but I'm going to put a link to a web conference where we actually were able to hear from Dr. Dahlberg, and I think some of the examples that she gave really, really helped me wrap my head around not only what community level prevention is, but also like how you can know when it's not community level prevention.
That's great. And I'm assuming the resource sharing is to help people with resources on community level prevention and how they've been able to make the case. So that's great to see. Jen, anything you want to add here before we move to the next theme?
I feel like Ashley said so much of what I was thinking too, and what I've already kind of said, and I feel like maybe I can't say it enough, but it really is about our efforts being widespread and culture changing. And like Ashley said, sometimes that means we're showing up and we're doing work and we're not talking about sexual violence because we're trying to change the underlying structures that create this environment in which sexual violence exists. And so we come with that lens, we come with our hats on, but sometimes the work we're involved in to change things for everyone, where everyone is affected, whether they're involved in the intervention or not, sometimes that means that we're talking about something completely different, but yet still connected. And that's where all that multiple, working across multiple levels of multiple forms of violence and shared risk and protective factors comes into play as well.
Mm-hmm. Yeah. Well, that's a really great segue to our next point. Lots of people have been thinking more about these shared risk and protective factors across forms of violence. And this really stems out of research that the CDC and Prevention Institute did. That's an overview of the links across forms of violence and how the CDC also has set its strategic vision on addressing multiple forms of violence, but also how communities working with people have found that people are experiencing more than one, and it's not that these issues are happening in a vacuum. So people are really thinking about how can we think more about shared risk and protective factors or shared risk and resilience factors to solve multiple problems at once and be more efficient with our strategies. So Jen, how do you see this taking shape with communities that you're working with?
Yeah, I think people in communities are really looking and thinking about how different forms of violence are often experienced together. So as you mentioned, people don't exist in vacuums. We in our work tend to silo our work. I don't think anyone is shocked or surprised to hear that. Sometimes that's because of funding and time restrictions or other reasons where we silo our work, but people don't typically silo their experiences, right? They don't put their sexual violence in one bucket and their intimate partner violence experiences in another, or their youth violence or gang violence in yet another. And we know that from research, survivors of one form of violence are more likely to be victims of other forms of violence. Like, that's science, that's research. And so we really need to be thinking across violence types. There are many shared risk and protective factors among these types of violence. And I love the Connecting the Dots document from CDC. I think it does a really nice job of describing those connections, and then the strategic vision document goes even deeper and really helping us think about strategies for prevention through this lens. And so I wanted to, so just an example, so this is a slide from CDC that we use a lot when we're talking about risk and protective factors. This slide gives examples of possible strategies for addressing multiple forms of violence. And so a lot of these, we've been talking about on this call, which are the community and societal level changes, but all of these things, so at the individual level, we're looking at helping youth and their families solve problems nonviolently. How do we do prevention around substance abuse? How do we incorporate that into our work? These are all seen as risk factors for sexual violence and other forms of violence. At the relationship level, looking at we know that stress on families is one of those risk factors. We know that if we can get youth connected with supporting adults and pro-social peers and really connected to their schools, we're putting up some protective barriers for them, right? That's risk and protective factors 101 right there. At the community and society level, then we're looking at, as we've been talking about, changing norms, looking at how can we enhance community support and connectedness, because we know that when people feel really supported by their community and really connected to their community, the risk of violence decreases. And then also, what they found in the research around risk and protective factors is that it really helps when services are coordinated. And so that's getting at that piece where I talked about how we like to silo our work, and sometimes we've done that because of funding or because of other restrictions, but that is not how people do, people don't silo their experiences. And so thinking about how can we make a better effort to coordinate our services and really create these environments that are supportive and where people are connected, and that's kind of where we're really getting to changing the structures and the environments of communities.
So one thing that I wanted to say is how people are also thinking about connecting to other related issues, so not necessarily just other forms of violence, but also, in the Ohio example I mentioned infant mortality, or here I'm going to mention trauma, because we know that there are interconnections between these other issues and multiple forms of violence, just to complicate things, I guess. So the example here is the Association of State and Territorial Health Organizations, also known as ASTHO, released a legislative scan last month on adverse childhood experiences and housing stability for sexual violence prevention. And ASTHO believes that framing legislative efforts around modifying risk and protective factors supports multi-sector approaches for preventing different forms of violence. So we're sharing the link for that in the text chat if you want to learn more about their legislative scan and thinking about connecting different issue areas to violence as well. One example we have lifted up quite a bit is the work that's happening in the state of Colorado's Sexual Violence Prevention Program. They're focused on addressing priority shared risk and protective factors across their division through their state plan. And the 5 protective factors that are being addressed or bolstered include connectedness, positive social norms, good behavior health, economic stability, and resilience. And they're trying to address not only sexual violence, but also suicide, prescription drug overdose, older adult falls, motor vehicle crashes, interpersonal violence, maltreatment, traumatic brain injury. So there's lots of different issues that are under their umbrella. And the way that they're addressing these factors is they're really braiding and blending funding across departments, including education, public health, human services, and there's different programming and efforts that they're doing as part of this plan. So one that I wanted to highlight that we featured again on a Prevent Connect web conference in 2018 was the Hotspot Mapping that they're doing in schools. So 12 schools in Colorado are piloting this initiative to improve school climate and prevent multiple forms of violence, including sexual and teen dating violence. So what happens is students in the school get the opportunity to draw in on a map where they feel safe or where they feel unsafe in their school environment, and then based on that, they're able to come up with recommendations and strategies that can help improve safety in areas that may be identified as hot or red or unsafe environments. So they're both changing the negative spaces and then also promoting the positive ones. And just to connect back to the factors that they're focused on through this, there's both community and relationship level factors that include community disorganization or community and school connectedness, and youth and adult connectedness. So those are the types of things that they're hoping that just doing the hotspot mapping helps support addressing those factors. The last theme that we're going to talk about today is how the field is recognizing that alignment with social justice movements in other sectors is critical to bring together diverse perspectives, mobilize new approaches, and achieve shared goals. So even in the examples we've shown today, we've already seen partnerships. So even just in that last example with the hotspot mapping, that requires partnerships with schools and teachers and maybe even other community partners. Or the Ohio example, which also featured partnering with Planned Parenthood or the Women's Policy Network. So we've already started to see how partnerships take shape. And Ashley, I was wondering if you could share a little bit more about this partnership with sports that's being thought about more.
Yes, Alicia, thank you so much. So I'm really excited about this. And we'll go ahead and link to Reliance for those of you who aren't familiar with that, with Reliance. So for the sake of time, I'm not going to go into that. But I think when we think about sport, what's really exciting is that, you know, I'm sure you can all think about the people that you know, whether it's yourself or youth that you're connected to, or, you know, other folks, that sport really develops and influences millions of people throughout the lifespan, right? People play youth sports and they move on into high school sports and maybe collegiate and professional and even just for fun on the weekends. And I think what's really exciting too about sport is that when we're thinking about these connections to sport and violence prevention, it's not just the people who participate in sports, but it's also the spectators. You know, I don't necessarily play sports, but fun fact, I'm a really big soccer fan. And so even just being a spectator, there is such a deep connection. And that's really because sport plays such an important role and has such a great opportunity to really reflect and shape the values of the larger society, right? And so in that sense, I think that sport is really uniquely positioned to support and model healthy values and norms that can prevent violence. And that's not just within the sport system itself, but also because of its influence on the larger culture. And so I think that through sport can really be this platform of social change that can really lead to us shifting social norms, shifting attitudes, and shifting beliefs around sexual violence and domestic violence. And the Sport Plus Prevention Center, which I think, I'm not sure, yes, we've linked it. Thank you, Adina. Is really exciting because it really lays out how all of these individuals, whether it's the players, the coaches, the spectators, how all of those communities can be involved in different strategies to prevent sexual and domestic violence. And so you have examples here on the screen around policy, around partnerships, around building champions to really lead those changes in social norms. And then, of course, we know that also providing resources and raising awareness is another important piece. So the Sport Plus Prevention Center really walks you through all levels to look at comprehensive ways that we can begin to use sport as a platform for social change.
Great. Yeah, sports, I think, can really help with changing the norms and behaviors, and definitely check out that website there. Jen, I know that you've been doing some work with thinking about the media sector and the role that they have to play. Can you share more about that?
Yeah, absolutely. Most people, probably a lot of people on this call know about our 5 years of wonderful work with Berkeley Media Studies Group to create a comprehensive guide on how we can reframe sexual violence and focus on prevention. It really involves this big shift for us in the way we talk about our work. And it culminated into this guide, which is on the left of the screen. It says Moving Toward Prevention. That's our guide that was created. And also along with that was a toolkit for working with the media. We could not have timed this better with all the attention to Me Too and Time's Up. people were really trying to figure out, how do we talk about this? How do we get people engaged? How do we respond to all these requests? And how do we engage the media? And so I think this came at a really perfect time. Through our work with the media, this is just one example. There are many examples, and we're really looking forward to, as the messaging guide gets out there and we're starting to do some trainings on this for states, we're going to look forward to hearing how people are partnering and with the media in really changing the way we talk about sexual violence. So through just one piece of information from our work, we had the opportunity to partner with USA Today on the Sunshine Project. It was the first national survey of sexual harassment and abuse in Hollywood. So we were corresponding with reporters and editors from USA Today on their coverage of sexual harassment in the entertainment industry, and they tapped into us to help inform their decision around moving forward to develop and conduct a national survey. So this was huge, a great opportunity. So we partnered with them on this and informed the development of the survey questions, and they, through that partnership, they recognized us in the stories about their findings. The initial story was featured on the cover of the February 21st, 2018 edition, and it highlighted this key finding that you see here on the screen, that 94% of women in the entertainment industry experience sexual harassment. So going a step further, it's like, we can help you with this, but also we're going to help influence the way you talk about prevention in this. So we worked with their team to inform a series then of actually 3 installments of stories on the survey, and through that we were highlighting the role of workplaces and industries in workplace sexual violence prevention efforts. So really getting them to think and giving specifics around how prevention is possible in these environments. And so it really was this wonderful national platform and partnership that developed out of a lot of the media work that we were doing and some of the relationships that we've been working and developing over the past several years.
Wow, congrats on that partnership. Sounds like it's having quite an impact.
Yes.
I realized that we started talking about, partnering with other sectors and social justice movements, but I didn't really explain more of the connection of why that's important. And I just wanted to elevate the point that in doing community-level change and trying to work on some of those community-level factors, thinking about things like housing security, for example, isn't something that someone in the domestic or sexual violence field can do alone. And it is going to require bringing together several partners to change these factors or change these community environments that we're wanting to change. And together we have the power to do so. So the last example here about community partners, or about partnering with different sectors that I wanted to highlight, is the work that the North Carolina Coalition Against Domestic Violence has been doing together with the Charlotte Housing Authority. So the Charlotte Housing Authority is, of course, already thinking about things like housing security and providing housing, and through their partnership, they've been able to also think about more of the nuances with domestic violence and how they can also be incorporating things like bystander trainings for community leaders, the residents, even the people that they're contracting out with as vendors, their staff. They've also been having community meetings to really encourage more of the social connectedness among people, and they also did a youth outreach contest and a social marketing campaign, which really is helping contribute to those norms of making it a community issue and supporting safety within the housing authority. So that's just another example of how people that are in this field are partnering with people that are outside of the field. I know that, a public health approach that considers health equity, focuses on the community level, works across forms of violence, and requires partnerships can sound really overwhelming. And that's what our 5 themes highlight. And so, Jen, I know that you've been talking about these types of things in your trainings and making them more digestible. How have you been doing this?
Yeah, digestible is a good, it is a stretch. So this is no pun intended. This leads me to my next couple of slides where we have actually literally had people get up and stretch through these slides and this portion of some of the training that we've been doing because we know that the part that communities have really been asking for more support around is that community level prevention. Like, what does that shift mean? Like, what does it mean for me? What is it going to mean to the work that I'm already doing? Can I just add on to the work I'm already doing? Do I have to stop the work I'm already doing? People want to know more about what it means, and not just, not just the community-specific work that they've been doing, which is super important and a big piece of this. But this is a lot bigger, thinking about what we talked about before with laws and policies and structures, it's really bigger than many of us have ever gone before. So we created some activities, again, one where we have, that's one where we have people kind of stretch through these slides of, what are the needs of your community? What are your community's priorities? And getting people to stand up and stretch and do some brainstorming as we're capturing things on flip charts. What programs, there's a little weird thing going off the slide, but what programs and strategies are already working at the community level? What do you already have going on? Getting people to stretch even further and think about, what about beyond sexual violence prevention? Who are people you could collaborate with? Who are organizations that you can collaborate with? And getting people to really think about stretching to this level. And really, this piece especially really opens up the conversation around partnerships. Who are people partnering with, and who can they think about partnering with if they're not already, and if they're hearing other people say, well, I partner with this, and I partner with them. They're getting ideas of, oh, wait, how does that work? I'm going to talk with you later about this, or I'm going to, connect with you via email. So these are just some of the slides we've used in our training that sort of culminates into this this last slide, which I know kind of goes into the next question I think you have.
And I hope that everyone just got up and stretched, because those of us at the Prevention definitely just stretched. So, and I hope some of you are currently in public seating areas at your work where others are watching you stretch. But yeah, Jen, we'd love if you could take us through an example of an activity that you use.
Sure. A lot of that, what I just talked about, culminates into this practice piece. So we're asking people to think about, we're giving them a program to look at. So we put this slide up, and the questions are, what level of the social ecological model does this program reach? In what ways is the program community specific? What are some of the community needs? And what are ideas to expand to the community level? And as we put this up, we're passing out, and we've separated folks into groups, and we're passing out program examples to groups, on paper. So I'm going to show you an example. So many of you have heard of Coaching Boys into Men. If you haven't, what rock have you been hiding under? Because I'd maybe like to go there someday when I get a little overwhelmed. But Coaching Boys into Men is a great program from Futures. So we use this as an example because a lot of communities are using this program or similar. So this is something, for instance, we'll hand out, and so they read as a group together. So a local high school is using CBIM for their prevention work. The coaches lead the athletes through a brief session before their twice-weekly practice. The students enjoy the sessions. They've been talking about how everyone else in the school should also have these sessions because the school climate is problematic. A lot of the girls are shamed for their clothes. Teachers don't take harassment or jokes seriously. So the person who's, the preventionist who's working with the coaches says, well, that's a nice idea, but Coaching Boys into Men is specifically designed for student athletes, and specifically male, we should put in here, those who identify as male, and not everyone in the school is part of a sports team. So we put this out there, and then we give them those questions to think about. So we say, where is this on the SEM? And most people identify that a lot of the work for Coaching Boys into Men really is focused on individual and relationship level change. Through the lesson, the awesome lessons that they go through. And so most of them can easily say, oh, we know about this program, it definitely is changing individual attitudes and behaviors, and at the relationship level as well. And then we say, okay, so in what ways is Coaching Boys into Men community specific? And so in this particular example, it's specific, to the needs of athletes. Like it's looking at athletes, it's looking at male athletes. when we ask them what are some of the school's needs, a lot of times they're saying, well, it looks like they definitely need some work around their culture and climate change, right? They've said that girls are being harassed. They've said that, it's not necessarily a safe environment for everyone. Another need that folks identify a lot when they're reading this example is that programs for students who identify as female or not male and who are outside of the sports are being left out as well. So it sounds like there are needs that aren't being met. And so then we get to the question, and really this is where we hone in on what are ideas to expand this prevention into the community level. And a lot of times people are able to pull out, once we've gone through this entire training, a couple hours of talking about community level work, they're usually mentioning we can create or update anti-harassment policies at the school. We can look at some school-wide media campaigns to reinforce the culture that that the students want to see. So ultimately, usually what they're doing at this level is they're looking at a typical program that's done at the individual and relationship level and having a chance to work in a group and think about how can we expand this. And ultimately, it's really about trying to affect change for everyone in the school, regardless of whether they've been involved in coaching boys into men or not. So that's just one example of how we're using that activity.
Cool. And another way to expand it to the community level might be, like, for example, the work that Colorado has been doing around hotspot mapping. That might also help with expanding it to community level, and I'm sure others have more ideas. But before we end off our session for today, are there any other activities that you've been using? I'm sure there's many, but can you maybe share one more?
Yeah, we do World Cafe activity, and this is, again, that thing where after we've talked a lot and done some activities, we like to give people a chance to sit together. So in our trainings, we often give a lot of information. And so in order for them to be able to incorporate opportunities to think about their communities and exchange ideas in smaller groups, we implement the World Cafe model. So this is a model which is really a structured group conversation model. It's also a knowledge sharing opportunity where small groups come together and discuss a topic. So you have several tables, and people are sitting, a smaller group is sitting at each table, and they each have a different question. And then they're given opportunities after talking for a while to switch tables periodically and get introduced to the previous discussion at that table by a table host. So there's a table host at each table that remains a constant there to kind of keep the conversation going and fill people in on what's already been talked about. And they're all the time they're writing, drawing, whatever they're doing, they want to do, they can capture all of their thoughts on the paper. So some of the questions that we've asked in the trainings we've done around community level prevention are the first one of the tables will have a question that says, what should people know about working in your community? And we ask people to be specific. What is your community? What are the needs? What are their strengths? What do we need to know in order to work together effectively? We have another table topic where we're asking where are areas where oppression intersects with sexual violence. Think about systems, norms in your community, harmful beliefs, power, laws, policies. And this is very interesting because a lot of times when we see the paper, it's like we do a lot of work in rural areas and we do a lot of work sometimes in urban areas, and there's very interesting things that are coming out specific to where people are located. And how their community identifies sort of geographically and demographically. And then we have another table where they're talking about what are ways to include those impacted by decisions in the decision-making process. Novel idea, right? So thinking about policies or standards of care or procedures or norms or programming, how do we involve those who we're trying to impact in those decisions? And then we also will have another table where they're talking about an example of an effective community partnership. And this is where they get to talk about, here's something that's working in our community, here's where we're making connections, here's what made it work, and here's what we had to implement or what we have to do to keep it moving and working smoothly. And so what that does is it sort of culminates into this, these really great, and we don't have a lot of people that draw in our groups, but we have a lot of people that write, which is great. So we'll have these beautiful charts at the end of the session where it's full of great information. They can share these then. We usually have them come up in groups and share. We have them get together and look at common themes any aha moments, and circle those things and talk about those things with the entire group. We get feedback that this particular activity is one of the favorite parts of the trainings that we do because they walk away, they have all this information, then they get a chance to really put it into practice and think about how it is specific to their community. They get to learn from one another, and they walk away with new ideas and hopefully new ways to approach their prevention work in the communities, and really thinking about partnerships, structures, things that will really have an impact on their shift to the community level work.
Thank you so much for sharing, Jen. I think that these are great tools that everyone on the web conference can use in their communities and start to do things like these world cafes or different examples to get people moving more towards community level and thinking about our emerging themes. So again, we're having some issues getting the themes on the slide for some reason, but Tori is currently pasting them again into the text chat. So our 5 themes today had to do with health equity, improving community environments, working across multiple forms of violence, and of course, partnering across sectors and movements. And so with those in mind, we wanted to end off our session before we have Jen give her final tips. We wanted to ask you, with keeping these things in mind, I know that we're not saying Happy New Year at this point in the month. I think there's some cutoff date or something. But, people are still interested in goal setting at the beginning of the year. What is one of your prevention goals for 2019? And what's an initial step that you'd like to take? Because sometimes our goals can be larger and taking that first step might seem difficult. So I'd like you to start thinking about both of those as we close off our session for today. And please share in the text chat if you're open to sharing your goals with us. And so Jen, we really enjoyed having you here today, and I really appreciated our conversation and talking through these themes and how it comes up in the work you're doing. Can you close us off with some of your final tips for everyone?
Sure, yeah, this has been really fun for me to talk through this. I would say these are some of the tips that we typically give to folks, like start with your strengths. And we like to do that rather than needs because we find that when people really focus on their strengths, they have a lot more strengths than they know. Look for new partners, and in doing that, be open to looking outside your typical partners and programs. Be open to new strategies based on what the needs are, and also co-create with communities. This is huge and probably should be number one because communities are the experts on their strengths and needs, on what they need, what they feel they are good at, and just as we said, community-specific and community-focused efforts are so important and just are totally, super relevant to like all the things we're talking about with community level work, but we have to be specific to the community and we have to involve the community in everything we do. And so that's another key tip that we have as well.
Great tips, Jen. So we're going to just share some tools and resources. I know there were a lot of resources shared throughout, but we wanted to just summarize some of the ones that we had that we think are, foundational for this topic. So we already mentioned NSVRC's Innovations Report. NSVRC also has a primary prevention primer that you can take a look at. We're sharing the links in the text chat to these various resources. And you'll have access to the slides that you can also access these. We also recommend checking out CDC's technical packages. They're based on the best available research, and there's ones for different forms of violence, and they go through various approaches and promising strategies for prevention. So a great place to start for those of you who are new. Again, Prevent Connect and Prevention Institute release guest profiles based on the web conferences we've been doing over the past year. And so if you want to take a look at those, we'll share the link for that as well. And I think finally, Prevention Institute has a large report all about a health equity and multi-sector approach to preventing domestic violence. And for those of you who are wanting the shorter version, we have a summary that's maybe under 10 pages. I'd like to say that it's under 10 pages that provides an overview of our sectors acting for equity approach, which is all about primary prevention of domestic violence, really taking a health equity and multi-sector approach as well. So with that, I guess we can end our session for today. I'll hand it off to Ashley to close us out. But again, Jen, thanks for being a guest, and I've really enjoyed all the conversation that's been going on in the text chat and with Jen and Ashley and Tori and Abina orally. So thank you again for joining us.
Thanks, Alicia. And I'm having fun looking at people's 2019 prevention goals because they're still coming in. But I just want to thank you all for joining us today for this foundational web conference. I hope that if you have colleagues who you think would benefit from the information that was presented today, that you'll share the recording when we get it up. We will be compiling the text chat, so you will have access to all of the links that have been shared. There's been a lot of links shared, so you'll be able to access those if you didn't get them. But just wanted to thank you again for joining us for this web conference. Thank you so much to Jen Grove. It's always a pleasure to have you on a web conference and hear from you. And thank you, Alicia and Abina. Thank you, Tori. And thank you to our partners at Aberdeen Captioning. I hope you all have a wonderful rest of your day. And we'll see you on the next web conference. Take care. This ends